WFNC.
Live from Studio A at the Cumulus Broadcast House, it's Health View with your host, Dr. Angela Ruff. Your information leader for more than 65 years. News Talk 640.
WFNC.
Good morning, and you're listening to Health View. This is Dr. Angela Ruff, and our guest this morning is Dr. Yvette Stokes. Dr. Stokes is a pediatric dentist, and her practice is Highland Pediatric Dental, which is on Metro Medical Drive. If you have questions after this interview, would like to ask the doc some questions, her email is firstsmilesYMS@AOL. Their office number is 910-485-8749. Now, and Dr. Stokes is actually a local grown-up celebrity, graduated from Pine Forest High School.
Yes. And
I was a Terry Sanford girl.
Yes.
Yeah, I guess we were rivals. Yeah, I know. I didn't know you then. And she graduated from dental school in Nashville, Tennessee at Meharry Medical College. Got her pediatric training and a degree at the University of Maryland. And did your residency at the University of Maryland as well at the hospital there.
Yes.
So you are well trained when it comes to dealing with children.
I am. So, yeah.
And you have 4 kids yourself, so that's pretty impressive.
That's right.
And married to a very nice attorney, Stephen Stokes. So, and I know him well. And they're just y'all just make a mighty fine couple. Great addition.
Thank you.
Great part of the family. So thank you for coming out with us. And I tell you, I get tons of questions from parents about their kids. You know, probably maybe one of the top question I get is, at what age should children start seeing the dentist? And I know before we got started, you were telling me that there's something that the National Pediatric Association advises. So maybe you can expand on that.
The American Academy of Pediatric Dentistry has joined with Head Start program, and they have a recommendation that children have a dental home by the age of 1. That is primarily due to their push and their aid in prevention. You know, it is our goal not to only treat children when they have problems, but it's our goal to prevent dental disease. Mm-hmm. And you can only prevent dental disease when you have properly educated a parent, properly educated children, and the earlier that happens, the more successful you're going to be.
Sure. And I know probably a lot of people have heard of bottle decay.
Exactly.
It doesn't necessarily require a bottle. Mm-hmm. Maybe you can help people understand what causes this.
The most common cause of decay in very young children is prolonged nursing, prolonged bottle use, or prolonged use of a sippy cup. Mm-hmm. It is not uncommon to see a child at 12 months, at 18 months, at 2 years that already have decay. So if we can see a child very early at 12 months, the majority of those children, we can give preventive information to the parent and prevent disease, basically by informing them of how the use of a bottle, the use of a sippy cup, the sugary drinks that you put in there, i.e. milk, soda, fruit juices, prolonged use of those products can cause decay. Those products should not be used on an at-will basis. Mm-hmm. They should be used at scheduled time frames, and definitely nothing at night that has sugar in it. Right. And therefore, you decrease the amount of sugar that is on the teeth, and you will decrease caries by doing that.
Actually, I've had 2 dental assistants that, when they're great dental assistants, that worked with me, that had young kids that had bottle decay, and they were just mortified that their kids ended up getting cavities. You know, because here they're in the field, and it wasn't by a bottle, it wasn't by nursing, it was by a sippy cup.
Exactly.
And the caregiver, while they were at work, would put something there that you'd think was healthy, was apple juice. And sure enough, I mean, they just ended up with a ton of decay in spite of their parent brushing their teeth for them.
Right. And apple juice not only has high sugar content, but it also has high acidity content. So there's 2 things going on there. And if a child can pretty much go get those fruit juices, apple juice, sodas whenever they want to, because at the time they're using a sippy cup, they're old enough to go get it when they want it. They're old enough to ask for it. So if we're giving them those things without thinking about how often they're taking that in, they could be bathing their teeth with those products through the sippy cup all day long. And the sippy cup is not necessarily very different from a bottle, because you're sipping, you're sucking through either a soft or a hard. It could be soft or hard, but you're still sucking. And when you suck, you pull the liquid to the backs of those front teeth on the top. And then that's where we see cavities, usually in the very young children. The cavities start there behind those front top teeth.
Right. I was either thinking that or crystal meth. I mean,
well, I can see some children's mouths that actually is very similar to that.
It looks a lot like it, doesn't it?
It looks a lot. It does, and it's very sad to see a young child with a mouth that looks like that. It's very sad, and it's very debilitating. It's painful.
Right.
Parents sometimes think that children don't hurt the same way we hurt as adults, but I can guarantee you that a child that has a lot of decay is an uncomfortable child.
Right.
And they are uncomfortable all the time. They may not be screaming in pain, but they're uncomfortable all the time.
Right.
A child that has that much decay, and I see the children with the abscesses, that is just as painful for a child as it is for an adult.
Right.
Those teeth need the exact same care that an adult does.
It's frustrating when you have a parent or grandparent bring a kid in, and like you said, they have several abscess teeth, and they never get the treatment done.
Right.
And you just kind of wonder. And I tell you, I've contacted social services before. This kid just continues to have the parent never helps them.
Right. Well, there's just a myth that these teeth will fall out. But a lot of the back molars in a child, they don't fall out until age 12.
Right.
So when you're seeing a child, as you often are, at age 3, 4, 5, look at how many more years those decaying teeth, those abscess teeth, are actually going to stay there. So there's this little myth by parents that, well, the teeth are going to fall out. We really don't need to fix them. Well, you absolutely do. If you want a healthy child, you want a child that is happy and free of pain, it has to be pretty miserable to have a toothache, even if it's a mild toothache. All the time. That has to be a pretty miserable
and distracting if you think about them trying to learn in school.
Absolutely.
And they're in pain all the time.
Absolutely distracting.
Now, I'm sure I get this from parents, and I'm sure you do as well, is, well, gosh, why don't you just go ahead and pull the bad teeth? What would be your response?
Well, my response is those teeth are there for a reason. They are there, first of all, to guide permanent teeth in. If we are taking teeth out very early, there's a consequence to that. We interfere with the guidance of the permanent teeth later on. So if we take out teeth in the back, then we have to put spacers in to hold those spaces open. There is no better space maintainer than your natural tooth.
The tooth itself, yeah.
Exactly. We take out a tooth when we have to take out a tooth, when there's really very little other consequence, know.
And the spacers, they tend to kind of come off if the child eats now-laters or
it's just
like that.
You have to be careful with them, because then you have introduced an artificial appliance into the mouth. And although they can be very easily worn, it's just not like your natural tooth.
Right.
It's
definitely
like
keeping your tooth is better.
Absolutely. And we stress that if we can save a tooth, we tell a parent it is worth saving a tooth than what you have to go through after you've extracted a tooth, done a space maintainer. Then you have to worry about what's going to go on later on with braces, and there's nothing better to eat with than your natural tooth.
Right.
Nothing better.
Right. Yeah. Surely, and of course, you don't want all the other teeth kind of crowding in once that tooth is out. And then where does the permanent tooth go? Moving
into those spaces if you don't put a space maintainer in. So if you take out a tooth and you don't save that space, then teeth start to shift, teeth start to tilt. And then you've created a whole other problem. You can create periodontal disease by doing that later on down the line. So we try to eliminate all those things, and the way to eliminate all those things is to save teeth if you can.
Now, one thing that I've noticed, and probably parents notice more often, is when their kids start getting into that mixed dentition stage, is, oh my God, all the permanent teeth are yellow.
Oh yeah. Well, when the permanent teeth start to come in, primary teeth, the baby teeth, are often much whiter than permanent teeth. So as the top teeth and the bottom teeth in the front start to come in, parents say, there's something wrong with the color of those teeth. Well, it's a stark contrast because you're looking at baby teeth next to permanent teeth, and they do look more yellow, but it's their normal color.
Right.
There's nothing wrong with those.
Right.
And there's nothing that we recommend you do about that color until the child is much, much older and they're old enough for bleaching, which may not be until 15, 16 years old. It's not something that we do when those teeth first come in. It's something that we may do when all of the permanent teeth are in.
Right.
And you've had braces if you're going to do braces. After that, then you consider bleaching teeth.
Right. I've had some pageant kid parents that you've had this too, and they're like, let's bleach their teeth. And
absolutely.
They're like 6,
And that, of course, I don't even know anyone that would bleach a 6-year-old's teeth, but
Right.
you just don't do that.
Right.
Those teeth are very young. The roots are undeveloped, and
you don't want the child swallowing it.
We don't want the child swallowing the bleach, and an adult can know not to swallow, not to do those things that a 6-year-old just simply does not know.
Yeah.
And then you would get uneven bleaching if you did something on a 6-year-old. Then when other teeth come in, it's very difficult to bleach one tooth unless you're doing some very, very expensive bleaching, which it just gets very complicated, and you don't want to do that.
Right.
You don't want to do that.
Well, they can wait. Maybe just paint a little bit of white out or something.
They can wait. People understand that those 6-year-olds are beautiful, and it's okay that their teeth look like that.
Yeah.
It's normal.
Right. My dad was dentist, and I ended up knocking out both my 2 front baby teeth when I was 4. So I was like, in all Christmas photos, I had no front teeth for 3 or 4 years. My dad was proud. Yeah, I made the family proud at an early age. You're messing up our pictures. What's wrong with you, kid? Anyways, well, let's see. Some of the other questions I hear is maybe what are some things that parents can do for prevention?
Well, prevention, number one, is sort of like, in order to be a healthy person, you also have to have a healthy mouth. So you think that from the very beginning. What are you putting in a child's mouth? And some things, like you say, the apple juice, the drinks, those things are healthy, but they are healthy in the proper doses. It's sort of just like sedating a dental patient. I have this theory that drugs are a wonderful thing when used in the appropriate doses on a child or on an adult. It can create just a wonderful experience.
Right.
But when you're doing those things in an unhealthy environment and unhealthy doses, then they create problems.
And I'm going to ask you more about that when we get back after our break, because some things have been in the news and all.
Okay. All right. So when you're using the sippy cup and the juices, you just want to use them in the appropriate doses. I tell parents that give a child juice or milk at meal times. Let them drink, and it really doesn't matter how much they drink at meal times because they don't typically sit at the table for more than maybe 30 minutes when you're having a meal. You're not there for 3 hours.
Right.
So then you can consume a good amount of juice and it still be healthier for you than if you took 3 hours to drink that same amount of juice if you're walking around with a sippy cup or bottle. Because of the time that you're bathing those teeth with that juice. So that's the important thing. And then I tell them to buy the kid a fun water bottle. Let them pick something out. And then when they want something in between, when they're running around playing, let them have their fun water bottle. And that's what they drink in between meals. You kind of have to make it fun for them if you're changing from habits that are not good.
What do you think of some of these sugar-free option of choices that still taste sweet? What do you think of that with kids?
Well, I haven't looked at a lot of the research, but I am not very big on doing a lot of artificial sweeteners with children. We just don't know what they're going to say about that way down the road. If we start giving a 2-year-old all these artificial sweeteners. I'm just not sure about that.
I tried one this weekend, and it gave me this great idea. It's called mint water or something. And basically, all they didn't add any sweetener. They just add like an extract of mint in there. And I'm thinking, that my mint grows like weed in my backyard. In fact, my backyard is a bunch of weed mint. So I was thinking I could just take live mint and put it in my bottled water and get that same flavoring.
Right.
And maybe I could sell it, have a side business here.
We'll talk about that later.
Yeah.
Maybe we can do that together.
That'd be great. Yeah, live mint water. Okay, well, when we get back, I do want to ask you more questions about sedation with kids. And that's a common question I get, especially with some of the things we've read in the news with some people who are not doing it in a safe environment environment or using safe precautions.
Yes.
I know you do use all the safety features. So we'll talk about that when we get back. This is Dr. Angela Ruff, and again, our guest this morning is Dr. Yvette Stokes. You're listening to News Talk 640 WFNC.